Okay, so it's summer and your child has ear tubes. And so every parent is asking, well, can they get in the water? Is it safe to swim? Here's what the studies show and what the current recommendations are. So ear tubes are tympanostomy tubes, are those little tubes that we put in kids' ears to help avoid infections. They help drain out fluid and then keep the pressure, inside the eardrum and outside stable. So then the big question is, well, that hole, does that allow water in and lead to further infections? The short answer for most kids, no, they seem to be doing just fine. The American Academy of Otolaryngology Head and Neck Surgery has recommended letting kids swim. You don't need to use earplugs, the headbands, the caps or things like that to keep water out. There's been multiple studies that have shown that routine use of the earplugs actually really doesn't make a difference anyway. So surface water swimming, maybe even shallow diving, the pressure doesn't build up enough to push the water through the tubes. And there's even a study that suggests that deeper water diving may not be a problem either. Now, there are some exceptions to that, of course. There's kind of four that we talk about. First is in a child that has active drainage or an active infection. You'd want to get that cleared up before you let them swim. Use some of those antibiotic ear drops and make sure, again, that their ears are dry before they get back in the water. Second is for kids that do have recurring drainage after swimming. Again, most kids do fine. There are exceptions to that. And if your child's one of those that has a lot of drainage whenever they swim, you need to be more cautious, maybe using earplugs or even having them keep their ears out of the water. Third is swimming in dirty water. So that's lakes, pools that aren't treated, streams, ponds, those types of things. There are studies that suggest that drainage is more common after swimming in dirty water like that. And then fourth is a group of kids that just their ears hurt when they swim, when they have tubes. It's not that they drain or anything like that. They're just more uncomfortable. For that group of kids, you need to be more cautious as well. So bottom line is most kids with tubes can swim with no earplugs needed. If your child does have drainage or problems like that, good idea to reach out to your pediatrician or your ENT. Talk with them about it. Maybe get a game plan for the summer, how they can still enjoy the water. Now your nose, follow for more.